Hi, I'm Dr. Devin Garza. I've been practicing in Austin, Texas, private practice OBGYN for 28 years at this point. I currently no longer do obstetrics. I do miss it to some degree, but my practice revolves around complex robotic approach to minimally invasive surgery. All of that essentially revolves around a platform known as Da Vinci or robotics. It's not really a robot. I tell folks this all the time. It looks like one. We nicknamed it robotic. In reality, it's my hands and many surgeons, but my hands will control the tools that we use intraoperatively to give you a more precise surgery. In other words, if there's a computer-enhanced surgery, which is what this should be called, I can see better, and my wristed movements translate down into long instruments through tiny little incisions in your abdomen that have an instrument working function about that big. So we're able to do some very, very precise stuff. I take care of everything from management of fibroids, myomectomies, minimally invasive approach to very complex hysterectomies, uterine sparing techniques for infertility surgery, pelvic pain, endometriosis, some of the more complex cases that it takes experience to perform these. Other ones such as transabdominal cerclages through a robotic approach. All of these, putting your tubes back together if you've had a sterilization process and you want to try to get pregnant again. All of these require precision. And we're able to do this even better than if we were to make a big incision, a bikini cut, or an incision from here down to here. Of course, you take so long to heal from those, but there's still more advantage of precision on the robotic platform. That's why my practice is named Texas Robotic Surgery for Women. I only do gynecology surgery, and typically I do what's called referral-based surgery. So for doctors who would like their patients to have a surgery done minimally invasively so that you heal quicker, so that there's less blood loss, that there's less risk of infection, but you have to be experienced to do that. And so that's a lot of what I take care of. It's a snapshot of my practice. I hope you enjoy and have some education value from some of the videos you're about to hear.